Hypertension Awareness Series Episode 16. The silent damage high blood pressure causes inside your body. Good morning. Today we learn about hypertension-mediated organ damage. Hypertension is not just a blood pressure number. When pressure remains elevated over time, it quietly damages the vital organs throughout the body. This is what we call hypertension-mediated organ damage, or HMOD. And the sad reality is that this damage often develops silently over many years without symptoms. That is why hypertension is often called the silent killer. Many people feel completely well until they suddenly don't. A complication has occurred. They have developed a stroke, sudden onset weakness. They have heart failure. They have kidney failure. They cannot see, or they get a heart attack. We do not treat hypertension just to lower the numbers, being BP-centric. We treat it to prevent these devastating complications. And detecting organ damage early helps us to assess the overall cardiovascular risk, decide when to intensify treatment, and prevent these complications: stroke, heart attack, heart failure, kidney disease. The important clinical principle to remember is that early detection of hypertension-mediated organ damage should be done at baseline on diagnosis and repeated periodically, often annually depending on the risk. This allows the silent damage to be detected early and the treatment to be adjusted accordingly. So let's see, what is this organ damage and the tests used to detect them. Number one is the brain or the central nervous system. The possible damage include a stroke, which can be ischemic or hemorrhagic. You can have a transient ischemic attack. You can also have dementia, forgetfulness. How do these symptoms present? Sudden weakness of the face, arm or leg, slurred speech, vision problems, or even decline in memory. And for the tests that we do for the brain, a CT brain, an MRI brain, or even a carotid Doppler to detect the plaques. Organ number two is the eyes. The retina vessels are very sensitive to elevated blood pressure. So damage to the eye is what we call hypertensive retinopathy, and very severe you can get papilloedema or retinal bleeds. Patients will often present with blurred vision, visual disturbances, and sometimes the damage on fundoscopy is picked early before symptoms appear. So for the test, fundoscopy or the eye examination. Organ number three is the heart. Persistently elevated blood pressure causes structural and electrical changes in the heart. So the damage in the heart includes left ventricular hypertrophy, what we call LVH, or thickening of the heart muscle, atrial fibrillation and other arrhythmias, diastolic dysfunction, heart failure, coronary artery disease. How do patients present? They may have palpitations, moyo inapiga haraka, shortness of breath, easy fatigability, reduced exercise tolerance. We learned about orthopnea, you cannot lie down, or paroxysmal nocturnal dyspnea, and you may also get chest pain. What tests do? We do an ECG, an echocardiogram, cardiac biomarkers, the troponin and the BNP. Organ number four is the kidney. Kidneys can cause hypertension, and they can also be a complication. So the effect on the kidney, you get chronic kidney disease. You can also get albuminuria or protein in urine. How do patients present? You get facial puffiness, which is very specific for kidney disease. You may have reduced urine output. You may have swelling of the body, leg swelling. And for the test, we discussed those earlier. You do your serum creatinine and calculate the GFR. Do a urinalysis, urine albumin creatinine ratio. And the important markers is when your GFR goes below 60 or you see albuminuria in urine. Organ number five is the arteries and the vascular system. Hypertension accelerates atherosclerosis and arterial stiffness. So the damage will come as carotid atherosclerosis. You can have widening of the aorta, aortic aneurysm, or peripheral artery disease, and erectile dysfunction, an early marker of vascular damage. Note, erectile dysfunction appears years before coronary artery disease because the penile arteries are very small. I did an earlier post on erectile dysfunction as a marker for early cardiovascular damage. You can refer to earlier posts. So how does vascular damage present? You can have leg pain on walking relieved by rest, what we call intermittent claudication, weak pulses, the legs are cold, and we have mentioned about erectile dysfunction. What tests do we do? Carotid Doppler ultrasound, ankle brachioindex, or a cardiac CT to do for coronary artery calcium. And the key markers are carotid breaks or coronary calcium score of more than 100. The sixth organ is peripheral nervous system, and this causes patients to come with neuropathies when the nerves are destroyed. So how do you present? Numbness, tingling, burning sensation, or even reduced sensation. And we test this through the neurological exams or nerve conduction studies if required. Organ number 7 is the autonomic nervous system. Autonomic dysfunction may occur in chronic cardiovascular disease and even chronic hypertension, and presents as symptoms of dizziness when you are studying, orthostatic hypotension, the BP goes down when you start, abnormal heart rate responses. And for the test for these are orthostatic BP measurements or autonomic function testing. The key message is to note that hypertension management should never be BP-centric alone, where we are focusing on the numbers. We must always ask, has high blood pressure already damaged organs? And that is why screening for organ damage should be done at diagnosis, periodically afterwards, often annually, but more frequent if organ damage has already occurred. And this screening, once picked early, it allows for more aggressive risk reduction, prevention of major cardiovascular events, and better long-term outcomes. Please remember, early detection and proper treatment can prevent or even slow organ damage. With good blood pressure control, many people will live long, purposeful lives. Proper hypertension care is not BP-centric. It assesses target organ damage to prevent complications. We said we need to maintain the standards of care. If you have hypertension, have a discussion with your doctor. Have the various organs been assessed? Have your heart been checked? How is your heart? How is your kidney? What of the brain? Are you starting forgetting? Are you getting numb? Talk with your doctor about assessment for the target organ damage. And we covered this in the prior episode on assessing and the tests that should be done in hypertension. Stay tuned for our next episode, very important episode 17, where I discuss what have we covered so far and where are we going next. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.